If you have SI joint pain, one thing that you should not do is this: get it manipulated. You don't adjust something that you want to stabilize. That would be the opposite of the goal. We're going to be talking about the SI joint. I want to look at some really cool images of the SI joint and talk about what is SI joint stability. What creates SI joint stability? I'm just going to share one story. When I was in physical therapy school, we had a seminar on the SI joint. I was super excited for it because I had SI joint problems at this time. It was a 3-day seminar, and we spent the majority of the time learning different manipulations for the SI joint, adjustments. By the end of the weekend, all of us had pain in our SI joints. We were all hurting. I remember having conversations with my classmates like, oh man, I'm sore. My SI joint hurts. It was just the irony of that situation taught me more than anything I learned in the seminar was that, man, it doesn't seem like SI joints really like being manipulated. That was really a big lesson for me in the beginning of this journey that I've been on of learning and researching and studying, what is this joint really for? And there's 2 SI joints, right? So they're on either side of the sacrum. And you can see that the shape of the contact surface is not very smooth, as you might think of in normal joints. We can look at something like the hip joint. We can see a nice ball in socket, a nice smooth, buttery surface. SI joint, the surfaces of the sacrum, and it's kind of bumpy and puzzle piecey, like a jigsaw puzzle. Doesn't really appear from a visual perspective that it's designed to move as much as other joints on the body. This is a view I appreciate. It's from the top looking down. We have a bird's eye view of the SI joints, and this is the joint here. If you can see my mouse, it's kind of jagged, right? The other thing that you should probably realize about the shape of these joints, this is a keystone shape. A keystone is the top stone that you put in an arch in architecture, is the strongest, most sturdy, stable point in the structure of an arch. And so that keystone brick is shaped like a wedge, and it wedges between the 2 sides of the arch. And this is exactly the same shape as the sacrum. It's a wedge that fits between this pelvis, and it forms a keystone. So by design, structurally, this is supposed to be a stable joint. But if you have SI joint pain, then one thing that you should not do is this. This is a picture of a patient getting her SI joint manipulated, adjusted by a hands-on professional. And when you adjust a joint, your goal is to loosen it. That's by definition what's happening. You don't adjust something that you want to stabilize. That would be the opposite of the goal. Most SI joint problems are actually a problem of moving too much, instability. They become hypermobile or unstable. Then our goal is to stabilize it. And so what are our tools? What do we have anatomy-wise? We have muscles and we have ligaments. So let's look at the muscles first. Here is all the posterior muscles of the hip. So there are only 2 muscles that cross the SI joint. So one thing you should know about muscles is muscles are designed to move joints. Joints do not move joints. They are just basically like hinges on a door. But somebody has to open and close that door. And that somebody in the body is the muscles. They are the only thing that create movement in the body. And so in order to move a joint, muscles have to cross that joint. And so, for example, the hip joint has a lot of muscles crossing the joint. If those muscles want to move that hip joint, all they do is have to contract and that joint moves. There are only 2 muscles in the body that properly cross the SI joint. One of them is the piriformis muscle. It's this triangle-shaped muscle right here. And the other one is the gluteus maximus, one of the biggest, strongest muscles in the entire body. That's all we have. And if we notice something about these muscles, the way in which they cross the SI joint is not advantageous for creating movement in that joint. The fibers of those muscles are perpendicular to the joint. And so what happens when these muscles contract is they don't actually move the joint, they compress the joint. The fibers are like this, and they are bringing the joint together, creating compression, stabilization. If we look at the gluteus maximus muscle on this side, same thing. The muscle fibers are perpendicular to the joint, compressing the joint when it contracts. And there are no muscles in the body that are crossing the joint in a sense that they are designed to move this SI joint. The body doesn't seem to have an intention in its design for the joint to move very much. So we have all these P-go-go-Q. So this is piriformis, gemellus superior, obturator externus, gemellus inferior, quadratus femoris. On the other side, we have another obturator internus. We have gluteus minimus here. These are deep hip muscles. Every single one of them properly crosses the hip joint. They're like the rotator cuff of the hip. And so the hip, as you saw, is really designed for movement. It's a ball and socket joint. We've got other hip muscles here. You can notice they don't even cross the SI joint. They go right up to it, but don't cross it. This muscle has no interest in moving that SI joint. This is a hip movement muscle, a hip flexor. Here's another one. Even the lower back muscles, they go right all the way through the spine to the sacrum. Don't cross that SI joint. And the pelvis moves as a whole. You can see that hip ball and socket really well, and all these muscles around it attaching to the pelvis, designed to move the pelvis and the hip. So if we want to stabilize our SI joint, we have the glutes and the piriformis. Well, piriformis, not really a very significant muscle. I don't have very much control over it. I can't contract my piriformis right now sitting here. So I think the piriformis is more part of a group of muscles that's, it's meant to work synergistically with all these other deep rotators. So we really have this one tool, the gluteus maximus, that crosses the entire SI joint, top to bottom, that we can work with, that compresses the joint. We can strengthen it and create tension in it to help stabilize the joint. There is something else in the body that provides stability for the SI joint. Ligaments. The SI joint is ligament heavy. It's got tons of them. Look at all the bright white fibers that you see. Those are ligaments of the SI joint. And so these ligaments create stability in the joint. And they're static structures. We don't have control. We can't contract our ligaments. They're statically designed to hold joints in place. So this is the back of the pelvis. Here's the front of the pelvis. Even on the front, it's very ligament heavy joint. You can't even see the joint. It's completely covered by ligaments. And so ligaments are those things that get sprained. When you sprain your ankle, you have torn or stretched or in some form strained a ligament in your ankle. We don't want to be moving these ligaments in a thrusting type manner to potentially injure them. And the ligaments get stretched out through trauma. It could be repetitive trauma, or it could be, an acute trauma like falling down or falling from a tree. And we can't say, I'm going to tighten my ligament. But what ligaments can do is they can heal. Over time, ligaments do heal. But you need to stabilize it for a while in order for that to happen. So it can't happen in a couple of days. Think about a knee injury. You tear your MCL, you're in a knee brace or on crutches initially for a significant amount of time, maybe weeks on crutches. You just don't want to move that ligament. You want to just let it heal. And then you're on a knee brace for a few more weeks. So it could potentially be 3 months to maybe even longer to give time to allow those ligaments to heal. This is basically the timeline that I would also apply to the SI joint ligaments. And we have the exercise, which would be the bridge. And we have some bridge modifications to help magnify the effect of the glutes that can compress that SI joint. In the video that came out recently, I talked about strapping a belt around your thighs. Push out into the belt and you're going to get these fibers, these glute fibers, to compress even harder in that same direction that compresses and stabilizes the joint. This is the exercise. This is the main one. If you can't tell, we don't have a lot of options. The major lesson that I want to get across with this is we have the tool that we have the glutes, and the best exercise for that is the bridge. And if we understand, the causes of SI joint problems, it often relates to imbalances in the muscles surrounding the joint, increased tightness on one side and decreased tightness on the other, creating torque in the joint. So we do want to create balance in the muscles. When we're talking about our ability to stabilize the joint, it's really just that one option. Everything else we're doing is going to be avoiding injuring those ligaments. Just like when you sprain your MCL or your ACL, you want to avoid injuring those ligaments for a period of time. I spoke recently about my history of SI joint problems, and I used to have severe pain and clicking and popping and instability. Now I do not have SI joint pain, and I do not have instability or the clicking and popping. But what I forgot to share was how long it took me to get to that point. It took me years to get that stability that I needed in my SI joint so that I could go do the things that I wanted and enjoyed in life without hurting myself. And it doesn't necessarily need to take years. It could take the amount of time that it takes a bone or a ligament to heal. This is a 3-month or longer process to get those ligaments, to allow them to heal. And in that time, you need to be nearly perfect in not doing things that are going to disrupt the healing of those ligaments. There is a lot of things that you can avoid. Getting adjustments to your SI joint would be one of them. It does have a little bit of movement. That's why it's not just straight bone, like fused bone. It has a tiny bit of movement, and that's probably advantageous to the body, but it's definitely not designed to move a lot. And with that understanding, knowing the tools that you have and the amount of time that it takes, it's really a long game. I believe that you can stabilize your SI joint. For different people, it's going to take different amounts of time, but the possibility is absolutely there. You have tons of ligaments on your side, and the goal is to just keep getting smarter about what your body needs and what to do and what not to do, and stay persistent with it. We appreciate you here at Core Balance Training for leaning into your health, and we'll see you again next week.